joys associated with getting older, but the constant need to urinate is not one of them. In this morning's Weekend House Call, WDSU medical editor Dr. Corey Hebert tells us ways to control the urge.
If you have to get to the bathroom right now and you worry that you might pee in your pants, it's possible you could have overactive bladder or OAB. Also known as urge incontinence, overactive bladder may occur when bladder muscles spasm or involuntarily contract, even when there is little urine in your bladder. Sometimes, however, the urge is purely sensory, and you get that feeling of urgency without any muscle contractions. In either case with OAB, there's a short circuit in your nervous system, so that signals which normally tell you when you really have to urinate mistakenly say, "Get to the bathroom ASAP." The bladder can hold up to 18 ounces of urine and typically signals you when you have to go to the bathroom when it's about 1/3 full. But if you have OAB, you may get this message when there are only a few ounces of liquid there, or none at all. This can make getting a good night's sleep pretty difficult, and that only contributes to the problems during the day. Although overactive bladder can develop at any age, it's more common in older adults, especially postmenopausal women. However, OAB is not a normal part of aging. It's usually due to medications, infection, obesity, diabetes, or for men, an enlarged prostate, and for women, the thinning of the tissue around the urethra. Fortunately, with the right treatment, overactive bladder can be managed or even cured. Lifestyle changes known as behavioral techniques are often the first treatment that are used to manage OAB. In behavioral therapy, you make some changes in the way you live day to day. This may include changing your diet to see if less caffeine, alcohol, and spicy foods will reduce your symptoms. There are also several drugs available to relax the bladder muscle and stop it from contracting at the wrong times. You can take some of these medicines by mouth, but with other drugs, you may use a gel or adhesive patch to deliver the medicine through the skin. You may take the drug alone or along with the behavioral therapy. There is also neuromodulation therapy. These treatments deliver harmless electrical impulses to nerves that can change how the nerves work. Some docs now are even using injections of botulinum toxin, better known as Botox, which can help patients who don't respond to other treatments. The injections into the bladder muscle may help it keep from contracting too often. But if you think that you have overactive bladder, the first thing you must do is go see your doctor, because as an adult, a little accident is never normal. I'm Dr. Corey Hebert with your Weekend House Call.